Hi, my name is Lisa Liu, and I'm one of the registered dietitians at St. Michael's Hospital Family Health Team. Today, I will be talking about managing constipation in children over the age of 1 year old. This video will talk about what is constipation, causes of constipation, and how to manage constipation. Constipation is poop, or also called stool, that builds up in the bowels and becomes very hard texture. Children often hold in their poop when they're scared, uncomfortable, or if there isn't enough time. When the poop is hard, it may be difficult to push out, and this can become very uncomfortable and difficult to pass. The pictures in the main box show examples of what hard poop may look like. A healthy-looking poop, or normal stool, is shown at the bottom box. How often children poop can change, but if your child has not pooped for more than 5 days in a row, it may be another sign of constipation. There are many causes of constipation, such as any significant changes in the diet, eating a diet low in fiber, drinking less fluids than usual, any changes in toilet routine, such as starting school or daycare, or being away from the home and traveling, not having enough toilet time, and having illness with fever or vomiting. How can I manage constipation? Today we'll be talking about 3 main tips. 1. Drinking more fluids and eating foods high in fiber. 2. Set up regular toilet routine. 3. Have regular physical activity and limit screen time. Constipation should clear up within 2 weeks by using these 3 tips. 1. Drinking enough fluids. We don't need children to drink large amounts of fluids at one time, as this can actually fill up their stomach and then they don't have enough room to eat healthy foods. We can just offer fluids with meals and snacks. Some fluids have been shown to help constipation, like certain juices, apple or pear juice. We can offer half a cup to 3/4 of a cup a day. Prunes or dried plums can also be shown to help constipation. We can offer 1 tablespoon a day. Eat high fiber foods. Fiber is a part of the food that our body cannot break down, and therefore it passes right through our digestive system. Fiber helps with constipation by making foods pass quickly through the digestive system, and then it makes it easier to have a bowel movement. Examples of foods high in fiber include vegetables, fruits, beans, lentils, nuts and seeds, and a variety of whole grains such as cereals, breads, rice, and pastas. Try to include high fiber foods at all meals, like at breakfast, lunch, and dinner, and also include high fiber foods at snacks. We can switch lower fiber foods with higher fiber foods as shown in the pictures. For example, we can switch having a meal with white rice and meat and instead choose brown rice and lentils as a higher fiber choice. For snacks, we can switch out cookies or crackers and instead offer a piece of fruit like an apple with peanut butter spread on top as a higher fiber choice. When increasing fiber, be sure to give your child lots of water too. Water helps fiber to do its job. We also want to remember we want to increase fiber slowly to avoid any symptoms like gas, cramping, or bloating. 2. Set up regular toilet routines. Bring your child to the toilet after meals, no matter if they need to use the toilet at all. This will help them to get used to going to the toilet. Having enough time for a relaxed toileting experience, provide a comfortable environment, and this could mean offering a footstool or support so that it's more comfortable to sit on the toilet. We may also want to keep a record of the frequency or any changes in texture of stool. You can think about what foods your child has eaten or any changes to the routines or environment at the same time. 3. Ensure your child has regular physical activity. Regular activity helps food move downward and helps the bowels move regularly. Physical activity simply means moving your bodies. And physical activity can be both indoors and outdoors and through all the seasons in the year. We recommend aiming for at least 60 minutes of physical activity a day. To encourage regular physical activity, we also want to help limit screen time. The recommendations are less than 1 hour a day for children under the age of 5 years old. Screens can mean computer screens, TV screens, iPads or phones, or video games. When should I contact my healthcare provider? If you have tried all of the tips we discussed today and constipation has not improved within 2 weeks, it may be time to contact your doctor. Other signs to look out for include if your child has severe stomach pain, fever, vomiting, weight loss, if the texture of the stool is round, hard balls for several days, if there's any blood in the stools, or if your child is very upset and cannot be soothed. Your healthcare provider may recommend to start a medication that can help with constipation. But remember, do not give your child any medications first without speaking to your healthcare provider. So in summary, we talked about 3 tips to manage constipation. Drink more fluids and eat foods high in fiber at all meals and snacks. Set up regular and comfortable toilet routine. Have regular physical activity and limit screen time. If you would like more information on managing constipation in children, you can refer to the websites below. And if you would like more information on foods high in fiber, you can refer to the website below. If you would like to discuss your child's concerns in more detail, we recommend you speak to your doctor, nurse, or registered dietitian. I thank you for watching.